Hello everyone, my name is Miho Takahashi and I'm from the Graduate School of Education at the University of Tokyo. I will now give a presentation on the topic, the impact of COVID-19 infection experience and the post-COVID-19 era, a Japan and Korea international comparison. I conducted this study together with Professor Lee Dong-fan of Sangyungon University, and I will now present a part of them. First, I will explain the background of this research. Starting in 2020, the spread of the COVID-19 worldwide has had severe physical and mental health consequences. These effects are noted to persist in the long term, leading to the definition of post-COVID-19 syndrome. Subsequently, as the COVID-19 was brought under control in various countries, infection levels were downgraded. For instance, South Korea lowered its level from 1 to level 2 in April 2020, and then to level 4 by August 2023. Similarly, in Japan, the level was downgraded from Category 2 to Category 5 in May 2023. In this trend, society has begun to treat the COVID-19 as a common disease, ushering the post-COVID-19 era. However, as I mentioned, given the medium to long-term impact of the COVID-19, it has been suggested that infection may have lasting effects even after the COVID-19. Therefore, we believe it is necessary to examine these aspects of the COVID-19 impact as well. Let's review the existing research. Various studies have been conducted on the effect of the COVID-19. Systematic reviews indicated that infection of COVID-19 can lead to severe depression or the emergence of depressive symptoms. Furthermore, some studies suggested that infection of COVID-19 can exacerbate PTSD symptoms. A comparative international study of Japan and Sweden reported that around half of the participants experienced physical symptoms after infection of the COVID-19, suggesting that these symptoms may also lead to mental health disorders. Thus, the impact of a COVID-19 infection has been shown to encompass not only medium to long-term depressive symptoms, but also various other effects such as post-traumatic stress disorder, PTSD, and somatic symptoms. However, it is unclear whether experiencing COVID-19 infection continues to influence depression, even after the COVID-19 has subsided. The mechanisms underlying these effects are also not yet fully understood. Furthermore, although Japan and South Korea are both in Asia, it has not yet been examined whether these experiences or mechanisms differ between the two countries. Therefore, this international comparative study between Japan and South Korea aims to examine whether experiencing a COVID-19 infection affects depression in the post-COVID-19 era, and if so, which mechanisms are involved in it. This research has been approved by the SKKU boards of the University of Tokyo and Sungkyunkwan University. The hypotheses for this study are as follows. 1. Experiencing a COVID-19 infection has an effect on depression even in the era of post-COVID-19. 2. The impact of experiencing a COVID-19 infection and depression is mediated by PTSD. 3. The impact of experiencing a COVID-19 infection and depression is mediated by somatic symptoms. 4. There is no big differences in the mechanism by which experiencing a COVID-19 infection affects depression between Japan and South Korea. Methods. Data were collected via web survey conducted from September to November 2023. Participants comprised 1,000 adults from Japan and South Korea. Of these, 714 were from Japan and 900 were from Korea. All respondents' data were used in the analysis. The variables, scales, and measures are as follows. To assess respondents' experience of infection of the COVID-19, we asked them to indicate whether or not they had infected the COVID-19 by the time they responded. To assess PTSD, we used PC-PTSD scale with slight adjustment to the wording for the context of the COVID-19. Somatic symptoms were measured using PHQ-15 and depression using PHQ-9. Japanese and Korean version were used for each measure. Please refer to Table 1 on the next page for the demographic data. This is the overview of participants. Participant attributes differ slightly between Japan and Korea, but the prevalence of experience of infection with COVID-19 is significantly higher in Korea than in Japan. Results. First, regarding PTSD. The left shows the Japanese result and the right shows the Korean result. Having experienced COVID-19 infection had a direct effect on depression. But an indirect effect was also observed. In Japan, the direct effect on infection experience of depression was 0.5, while an effect of 0.9 was observed from infection experience on PTSD, and an effect of 0.48 was seen from PTSD on depression. Similarly, in South Korea, a direct effect was observed from infection experience to depression, as well as indirect effect mediated by PTSD. Therefore, it was demonstrated that PTSD partially mediates the effect of infection experience on depression. Next, somatic symptoms. Neither Japan nor South Korea showed a direct effect from experiencing infection to depression. In both cases, however, infection experience influenced depression via somatic symptoms, suggesting full mediation by somatic symptoms. In other words, infection experience does not directly affect depression. When it does affect depression, it does so via somatic symptoms. Furthermore, the effect size was higher in Korea than in Japan. We also conducted a multi-population simultaneous analysis of the mediation model for PTSD and somatic symptoms to confirm whether they share the same structure. Examining configuration imbalance reveals that both PTSD and somatic symptoms were modeled in the same way. However, examining the parameters showed that the path coefficients were not equal in Japan, between Japan and Korea. This suggests that the magnitude of the path effects differs between the two countries. Specifically, Korea exhibits a stronger influence on all parts compared to Japan. Discussion. Regarding Hypothesis 1, we examine the long-term effects of experiencing a COVID-19 infection. The result indicated that infection experience influenced depression in both Japan and Korea, this supporting the hypothesis. Hypothesis 2 proposed that the impact of having an experience of infection with COVID-19 on depression is mediated by PTSD. However, both Japan and South Korea demonstrated that infection experience directly influenced depression, while also affecting it partially through PTSD. Therefore, this hypothesis was only partially supported. Hypothesis 3 proposed that the impact of COVID-19 infection on depression is mediated by somatic symptoms. In both Japan and South Korea, it was demonstrated that the impact of infection experience on depression is fully mediated by somatic symptoms. Therefore, this hypothesis can be considered supported. Finally, Hypothesis 4 examined whether Japan and South Korea had different models for how infection experience affects depression. The results showed no significant difference in the models. However, it was suggested that both PTSD and somatic symptoms had a greater influence in Korea than in Japan in all relationships. Consequently, while the model was supported, it was rejected in terms of the influence. Further perspectives. This study suggested that even in the post-COVID-19 era, the experience of infection persists. indicating that psychological support will continue to be necessary. Furthermore, as it has been demonstrated that depression is influenced by PTSD and somatic symptoms, care for PTSD and treatment for somatic symptoms are considered crucial. It is particularly important for somatic symptoms given their fully mediated effect. No major differences in mechanism were observed between the two countries. However, the impact was found to be stronger in Korea. Whether these differences in impact truly stems from differences in the prevalence rates between the two countries warrants further investigation. Future research. Although we are now in the post-COVID era, I believe it is necessary to continue tracking the subsequent effects. This concludes my presentation. Thank you for your attention. Thank you. Bye.